This is the Bay Area's news station. KRON 4 News Weekend starts now.
For your health this morning, some new dads may be feeling depressed and they're really not sure why. Well, it might be postpartum depression. And here to talk about that is Dr. Courtenay. He's a Oakland psychotherapist, the author of the book Dying to Be Men, and he's also researched postpartum depression in fathers. Will, thanks a lot for joining us this morning.
It's great to see you again, Marty.
You know, I think a lot of people don't think about dads suffering postpartum depression as moms do.
Right. They typically don't think about that, and it's surprisingly common. So we know actually from some good research that at least 1 in 7 dads experience depression. So that's 14% of dads in the United States.
Yeah.
And that amounts to 1,500 dads each day who become newly depressed.
What causes this depression in dads?
Well, so one of the things we could talk about is this new study that's come out that showed that men who had low levels of depression were at increased risk for postpartum, low levels, of testosterone. Were at risk for postpartum depression. They also found that high levels of testosterone were linked with parenting stress and also more depression in the partner, and also more partner aggression that the partner reported. So part of what this study highlights is really just the importance of looking at hormonal changes that dads go through, because we don't think about that. We typically think of pregnant women and nursing moms.
Right.
But dads go through these hormonal changes too, and it's a double whammy. Our testosterone levels go up and our testosterone levels go down and our estrogen levels go up.
So what should a man do about this? Should they be feeling depressed? Should they go see their doctor?
Absolutely. They need to get help for it. I mean, one of the worst thing about postpartum depression is not the depression itself, but the fact that too many men try to go it alone. And so, yes, getting help is probably the most important thing to do. And, partners can help with that in spotting depression, because if you know your partner, you're going to see if there's anything off, because depression in men doesn't always look like depression. It can look more like irritability and anger, working constantly, gambling or drinking too much. These are some of the ways that men experience and cope with depression differently.
And when a man is going through this after the birth of a child, they may not recognize it either. They might not understand why they're suddenly feeling more depressed or feeling more angry.
Right. And, it's very confusing with these hormonal changes that occur. I mean, it's really, they can wreak havoc on our bodies. I mean, we have increases in prolactin, which is linked with milk production in women. And so, these are intended to help us bond with our kids. It's nature's way of helping us bond.
Right.
Dads who have lower testosterone levels are more sympathetic to their children, and they're more responsive, say, to an infant's cries. But what we see with postpartum depression is that in dads, it's really sort of nature run amok, and that we need this sort of optimal level. Too much testosterone is not good, and too little testosterone is not good. So it's sort of like this Goldilocks principle, where right in the middle is what we need. We
have some tips that we want to share with our viewers that we found on the internet, and we wanted to get your thoughts about them. The first one is not to skip on sleep, to make sleep a priority.
That's really critical. We, besides hormonal changes like the ones we've been talking about, sleep is probably the biggest culprit in terms of postpartum depression, both for men and for women. We know that sick or colicky baby is too, and that's oftentimes linked with sleep and the problems with sleep. So number one, doing anything you can to focus on sleep, good sleep hygiene. So that one of the first things is to avoid caffeine or eliminate caffeine. And of course, when we're tired, that's the first place we go.
Exactly, to keep yourself going.
Right, exactly.
Okay.
So, exercise is important, definitely. And I think this list might have been written for moms, and of course they have to recover from childbirth, whereas dads don't. They can keep up with exercise right from the beginning, which is, we know, can reduce symptoms of depression.
One of the key factors here too on the list is to make your relationships a priority.
Yes. So men who have a rocky relationship are more prone to depression as well. And we know that, half of dads feel less loved after the baby comes along.
Sure, there's that whole jealousy thing.
Right, exactly, and being sort of sidelined. So yes, making the relationship a priority is important, and actually doing that before the child comes along is a good way to prevent postpartum depression. So focus on communication and working on that relationship.
And one of the most important factors here that men have a lot of trouble with is keeping their feelings inside.
Right. And again, that's where getting help is going to be important. And if a man doesn't do this for himself, he should do it for his newborn and his kids, because we know that if father's postpartum depression has negative and long-term consequences on the social, psychological, and behavioral development of his kids. And we see this in kids as young as 2, all the way through adolescence and into young adulthood.
Yeah.
So that's important.
Dr. Will Courtenay, thank you so much.
It's a pleasure.
We'll be right back.